due to COVID-19. It would provide eligible workers with $500 per week for up to 26 weeks between September 27, 2020 and September 25, 2021. Pour obtenir cette prestation, les travailleurs doivent se...
In order to have access to this benefit, workers need to be actively looking for work and work as soon as reasonable to do so.
Earn more than $1,000 in income a month from employment and self-employment income while still receiving the benefit. This will be extremely beneficial for both workers and businesses across. If a person's annual net income for the year is greater than $38,000, then they will be required to repay the benefit at a rate of 50 cents for each dollar above the net income until the benefit amount is reduced to zero. This mirrors our EI Working Well on Claim measure. Like EI, this new benefit will be paid in respect of the previous 2 weeks. This is different from the CERB, which was paid in advance. Afin de relancer son économie.
In order to restart the economy safely, Canada needs to also ensure that workers stay home if they get COVID-19 or have symptoms. The new Canada Recovery Sickness Benefit would avoid making people choose between their health and getting what they need. This benefit would give $500 a week for 2 weeks if workers are sick or if they need to self-isolate because of COVID-19.
While schools, daycares, and day program facilities are working to reopen and operate safely according to public health guidelines, closures can and will likely happen over the next year. The Canada Recovery Caregiving Benefit will provide $500 per week for up to 26 weeks per household for a worker who needs to take unpaid leave to care for a child under 12 or a family member due to a school, daycare, or day program closure as a result of COVID-19. Combined, these 3 new benefits would create a safe bridge to help Canadians span the gap between the complete lockdown of last spring and a safe and gradual reopening of the economy this fall and winter. I want to also take a moment to highlight our government's commitment to building a stronger workforce. As laid out in this throne speech, we have an opportunity to not just support Canadians, but grow their potential. That means making historic investments in training and working with provinces and territories to ensure Canadians across the country have access to the tools and skills training they need to succeed. As a first step, this bill outlines an investment of $1.5 billion to the provinces and territories to support on-the-ground training services for Canadians. This initial investment will be done through the existing workforce development agreements and labor market development agreements. We're digging in to make sure that we continue to support people because we're very much still in a crisis. If we want to get to the point where we build back better, we need to make sure that the people who need our help the most get the support they need. Thank you. Merci.
Okay. Thank you, Carla. J'aimerais d'abord remercier.
I would like to thank parents, teachers, teachers' assistants, janitors, support workers, and especially the children in schools who are studying at home throughout Canada. I know that times are hard for our children, and I appreciate what they're doing. I know that you're going above and beyond what we usually ask you every day, and you're facing a situation that no one would have expected a year ago. I know that it's not easy. All Canadians are supporting you wholeheartedly, and we are proud of the work that you have done. The fight against coronavirus remains our priority because coronavirus is still among us. It is a significant threat, as the Prime Minister said last night. Since March, our government believes that if we make the right choices regarding Canadians' health, we are also making good choices for the economy and for jobs.
Principle from the outset has been that the best economic policy is the right health policy. Economic health and recovery is impossible without public health and recovery. That's why our government today is introducing Bill C2, an act relating to economic recovery in response to COVID-19. Very simply, this legislation extends the Public Health Events of National Concern Payments Act, which is set to expire on September 30th, through to the end of December of this year. This act has made it possible for the federal government to help millions of Canadians and hundreds of thousands of Canadian businesses get through this crisis so far through various emergency support programs, including the absolutely essential Canada Emergency Response Benefit, the CERB, that has supported nearly 9 million Canadians. A failure to extend the legislation we are putting forward today could disrupt these payments with very harmful consequences for people's lives, for families, and for businesses across the country. De plus, en étendant cette législation, notre gouvernement pourra
By extending these programs, we will be able to continue to invest in vaccines and therapy. We will also be able to offer more screening tests and PPE to frontline workers.
Extending the legislation will allow our government to continue investing in vaccines and therapeutics and other essential medicines. It will allow us to continue to support testing and tracing and to buy PPE for essential workers. It will allow us to continue to support the provinces and territories and to improve the capacity of our healthcare system. In short, this legislation will provide ongoing support for Canada and Canadians as we fight the second wave of the coronavirus. That is why we are asking every member of Parliament to work with us to urgently pass Bill C2. And now we will hear from Philomena. Minister Tassi, à vous la parole.
The floor is yours.
Since the beginning of the COVID pandemic, our government has put Canadians first. We have worked to ensure they are healthy and safe and able to make ends meet during this pandemic. We have instituted measures and provided vital information to help Canadians do their part to prevent the spread of COVID-19. We are transitioning away from the Canadian Emergency Response Benefit. We are introducing the Canada Recovery Benefit, the Canada Recovery Sickness Benefit, and the Canada Recovery Caregiver Benefit, as Minister Qualtrough has outlined. We are also changing the Canada Labour Code to enable federally regulated workers job protection while they avail themselves of both the CRSB and the CRCB. Part 3 of the Canada Labour Code will be amended so federally regulated workers can take leave for up to 2 weeks if an employee is unable to work because they have contracted or might have contracted COVID-19, or because they have isolated themselves on the advice of their employer, a medical practitioner, a nurse practitioner, a person in authority, a government or public health authority for any reason related to COVID-19. And for up to 26 weeks in total, if an employee needing to provide care to a child who is under 12 years of age or to a family member who requires supervised care as a result of COVID-19. These are temporary measures to help Canadians overcome the challenges that they are facing because of the COVID-19 pandemic. We want to ensure that Canadians know that their job is protected if they stay at home to keep themselves and other Canadians safe. These changes are consistent with our program of supporting workers through COVID-19. We have worked collaboratively in an effort to keep workers safe and will continue to do so.
OK, on est prête à répondre à vos questions.
We can now take your questions. Thank you.
From the media, one question, one follow-up. We will start with 3 questions on the phone. Operator, can we please get the first question?
Thank you. Please press star 1 at this time if you have a question. Veuillez appuyer sur étoile 1 pour toute question. Our first question is from Jordan Press from the Canadian Press. Please go ahead. La parole est à vous.
Good morning, ministers. My question has to do with the fact that you're introducing this legislation that makes some changes to what you had proposed just a few weeks ago. And I'm curious about 2 things. One is how much of this is politics to gain some support from the opposition parties to get this done quickly? And 2, at the same time, what is the message that you provide to Canadians who need these benefits about why they're waiting basically until the 11th hour to actually get them?
Thank you for the question, Jordan. Quite frankly, when we announced these benefits more than a month ago, we signaled very clearly that we'd be watching closely what was happening in Canada with respect to the pandemic, around the safe return to school, around the job creation numbers. And we signaled very clearly a willingness to be flexible in the amount that we would be giving for the benefit. Quite frankly, the urgency of this cannot be understated. We have been signaling all along the need to put this legislation forth and have parties agreed to the urgency and the need to continue to support workers and families and vulnerable Canadians who will necessarily rely on these benefits for the months and for the year to come. So absolutely not, Jordan. We really were trying to be flexible from the beginning. We landed here because this is where the country is now in terms of the support workers need.
And follow-up?
And yeah, as a follow-up, actually, this might be for the Deputy Prime Minister. I'm curious about the promise yesterday in the throne speech in regards to the testing assistance response team, because it seems that no issue really has been causing more anxiety amongst Canadians right now than not being able to get tested for COVID-19. It's an issue for families, it's an issue for businesses as well. So I'm curious about that team and what that will actually do for getting rapid approval of rapid testing kits done so that you can address some of these anxieties Canadians have.
Okay, well, thank you very much for the question. And although that was your follow-up, there are 2 questions embedded in there, but I'm happy to answer both. On the testing assistance response team, I am thrilled that you noticed that and that you are underscoring it with your favorite new measures. I think it's something very important that we are doing. And as was described in the throne speech, what we're doing is standing up federal surge capacity to go in and provide support across the country for testing and tracing as needed. This is a new thing. I think Canadians can now see why it's a very, very valuable capacity to have that we want to build. You also asked a question about rapid tests. And let me say this. I am pretty sure that I can say that there is no one in Canada who is more enthusiastic about the prospect of getting rapid tests in our country, and no one who feels more urgently the need for them. Getting on top of the coronavirus and testing and tracing are one of the keys to doing that. Is completely essential to save lives, and it is completely essential to keep our economy strong. So I am all in, and I can tell you we as a government are very focused on that. Having said that, I think it's also very, very important for us to appreciate how valuable it is to live in a country where we respect the independence of our regulatory authorities and the independence of regulators to make their own careful medical judgments is more important today than ever. We are living through a global pandemic, and I know, frankly, as a mother, I want to be assured that any medicines, any tests that are used here in Canada have been approved by our regulators without any political interference or pressure. And look, the reality is this is not how it's working in some other countries. We are seeing interference and pressure on regulators around the world. And I think we can all see the very dangerous consequences of that kind of an approach. So that will not be the approach our government takes. And then finally, having said that, we also know we need to be ready to pounce and to procure new technologies, new tests, new vaccines, new therapeutics as soon as they get that good housekeeping seal of approval from Canadian regulators. And so we're not waiting. We are lining up in advance deals to buy the technologies, the tests, the vaccines, the medicines that will support Canadians. So the minute our regulators finish doing their very important work and get to the stage where they can say to us, yes, this is safe and healthy for Canadians, our government is going to be ready to jump in and buy these medicines and technologies for our country. Thanks for the question.
Thank you. Operator, we'll take the next question, please.
Thank you. Merci. Notre prochaine question est d'Émilie Bergeron de l'agence QMI. Please go ahead. La parole est à vous.
Oui, bonjour.
Yes, hi. If I understood correctly, you have increased the amount for the Canada Recovery Benefit from $400 to $500 a week. What or why did you make this decision? And do you think that this will be enough to have the NDP support for the confidence vote? Answer. I'll leave the second answer to the Leader of the House, but for the first question, we knew that we could make changes if the COVID situation changed, if the job situation changed. And as the Prime Minister said last night, we're in the second wave. I don't know how we say it in French, but we're in a second wave. And so we made the decision to have the same amount as the CERB in order to ensure continuity and to help workers as much as possible. Thank you. My second question is for Ms. Freeland. Yesterday, in his address to the nation, Mr. Trudeau said that there are certain investments to be made, and they can be made because the interest rates are at a historic low. But how can you guarantee that these interest rates will stay low? Some experts believe that these rates could increase eventually and that it's not a good plan for the future. Answer. Thank you for your question. Of course, the Prime Minister was right. It's important to highlight how low interest rates are today. For the government, the interest rates have been the lowest we've seen in 100 years. It's an important factor, and it's one factor that allows our government to do what the health of Canadians and our economic capacity. Another thing, second thing that's important, which gives us the capacity to do what we need to do today, is that the fiscal situation of our country at the beginning of this crisis was great. We were the best placed country of G7 countries, and that's a good thing because it allows Canada to do what is needed for this historic crisis. Thirdly, I would like to reassure you and reassure Canadians that we understand the importance of having a proper management of national finances. Our government understands the importance of this. We will continue to manage things responsibly. And the most responsible thing we can do today is to continue to fight coronavirus. Yes, it is expensive, but I have to say that it would be more expensive to not react. Thank you. Thank you. One more question over the phone.
Thank you. Merci. Our next question is from Bill Curry from the Globe and Mail. Please go ahead. La parole est à vous.
Thank you, for Minister Freeland. You mentioned earlier that another part of this bill extends the emergency payment section, which has language allowing you to spend all money required to do anything in relation to COVID-19. That was supposed to expire this month. It's going through now till the end of December. That clause was very controversial when it was originally brought in. Now that the House of Commons is sitting regularly, MPs can vote remotely. Why not just propose individual spending items to Parliament as they come along instead of giving Cabinet this sweeping power over the next 3 months to spend all money required to do anything?
Thanks for the question, Bill. And when you look carefully on the legislation that we have put forward, we have outlined in a lot of detail the specific spending measures that we are putting forward. We've been careful to ensure that these are spending measures directly connected to the fight against coronavirus. This is spending directly on healthcare, on things like vaccines, testing, and therapeutics, and it is spending on supporting Canadians as we do the necessary but economically difficult things we need to do to fight the virus. So we understand the responsibility to let Parliament and Canadians know what we're going to be spending the money on. And that's why we have offered a detailed schedule of the spending. I will also say that that detailed schedule doesn't cover every single thing that we may need to do in the fall. And we definitely do foresee that we will need to come back to Parliament and put forward additional programs as the need arises. Thanks.
And one follow-up.
Yes, on the wage subsidy extension that was announced in the throne speech, I know it's not part of this bill, but people were unclear yesterday. Given that the wage subsidy was scheduled to be phased out over the next few months, when you're extending it, at what levels are you extending it? Can either of you clear that up, please?
I'll take that question, Bill. It's a very good question. What has become clear to us as we have seen rising cases of coronavirus and truly a second wave in our 4 most populous provinces is that in addition to continuing our healthcare fight against coronavirus, we do need to extend support to Canadians and to Canadian businesses during this fight. So we will be extending the wage subsidy. The specifics on how we are going to do that, in terms of the specifics on how we are going to do that, we'll have more to say about that soon.
All right, we'll take questions in the room now. Go ahead.
Good afternoon, Ministers. Thanks very much for taking our questions. Marc-Andre Cossette with Global News. Deputy Prime Minister Freeland, you've now held the finance portfolio for just over a month now, and your government is now tabling Bill C2, which sounds like it will be a mammoth bill, essentially asking to extend the blank check of spending. So I wonder if you're now able to give us your thoughts on tabling a budget. Can Canadians expect to see a budget in this fiscal year?
Thank you very much for the question. As I said in response to Bill's question, we've taken some care in tabling Bill C2 to specify in some detail the additional spending authorities that we're seeking. And these are the overwhelming majority of them for programs that have been discussed and debated at great length in the country. As we said in the speech from the throne yesterday, we will be providing further fiscal information, a further fiscal update in the fall.
So how and when do you intend to get Bill C2 quickly through Parliament? Will you be seeking all-party consent for quick debate and votes on this bill?
You know, I think taking a step back, we can't, as I said, we can't stress the urgency of getting this bill through. I've worked very collaboratively with my critics. I know our House leaders working with other House leaders, trying to find a way forward that's going to give Canadians the support we have signaled for a month now that we intend to give them. I'll leave the House strategy to the experts on that, but I can assure you I'm doing my part, working with my colleagues across the aisle to make sure that this is collaboratively brought forward and supported by everyone.
Laurence Martin, Radio-Canada.
My question is for you, Madam Friedland. Regarding health transfers to the provinces, they made a clear demand for more money, but they want to be able to manage that money. However, what we heard yesterday in the throne speech is that your government wanted to be able to intervene by imposing standards, for example, in long-term care facilities. Why would you not simply give the money to the provinces? Answer. Thank you for your question, Laurence. I have a couple answers. I would like to start off by highlighting just how much the federal government has already supported the provinces and territories in the fight against COVID-19. It's a good thing, it was important, but I just wanted to highlight that we're already doing that. With our Safe Restart agreement, that's $19 billion, $13 billion of which is for health and to directly fight coronavirus. After that, we gave an additional $2 billion for schools, and before the Safe Restart, we gave $550 million to the provinces for health. It's important to highlight this for Canadians. The federal government is already there offering support. Another thing that I would like to highlight, and I think my colleague Dominique Leblanc said it very well last week. The main thing that we need to talk about is the fight against the coronavirus. We need to work on this and fight it together. This is the main issue. I would like to thank the premiers of the provinces and territories for their cooperation. We need to continue with it, and we will continue. I would like to come back to my question then. Do you not think that the provinces would be able to manage this money if you gave it to them? Answer. When we spend federal money at the federal level, we have a responsibility to Canadians. We need to be able to explain to Canadians the reasons why we spent money. Questions were asked today. Questions that are important regarding the federal government's spending. We do need to spend a lot. But as the finance minister of France said a few weeks ago, we need to spend quickly and we need to spend responsibly. That is an obligation that we have now. And at the federal level, we need to reassure Canadians that we are going to spend this money responsibly. We need to be able to explain to Canadians the reasons why money will be spent.
Tom Parry from CBC. Minister Qualtrough, the NDP has expressed a lot of concern about people transitioning off the CERB losing benefits. Does this legislation, does that take that into consideration? And also, given that we're going into a second wave, why not just extend the CERB?
Really good and important questions. I'll answer the second one first. So the CERB was put in place at a time when we basically shut down the economy and asked people to stay home. And we didn't know then what was coming, and we didn't know what we didn't know. I'd say now, as we move into economic recovery, we are much better placed to navigate our support in a more sophisticated way. So we've had time, for example, to improve our EI system to the point where 3/4 of the people who are currently on CERB can transition seamlessly next week to EI. So they have all the benefits of the EI system, whether it be access to training, working while on claim, access to sub-plans, all the things that made CERB a little bit clunky, to tell you the truth. So we're very interested in using that system to the greatest extent possible, but we know that that's not necessarily the case for all workers. And that's another thing that this pandemic has really exposed is the gaps in our employment insurance safety net. So we need to work on that. And the Prime Minister, as he said yesterday, is really committed to creating an EI system of the 21st century. I'm not worried about our systems not seamlessly transitioning people over in the coming weeks. I think we've created in Bill C2 a much more elegant balance between the need to not disincentivize work, but also support people who, regardless of effort, still aren't working or have significantly reduced hours.
And Minister Freeland, Jason Kenney's come out pretty strongly against the throne speech, saying that there's not enough in it for the resource sector for Western Canada. Given the anxiety that we've seen in Western Canada, why wasn't there more in the throne speech, I guess, directed specifically at those sectors or at the Western provinces?
Thank you for the question. And let me just say, our government collectively and I personally am very, very aware of the obligation to be a government for all Canadians. And also, you know, from a strictly Minister of Finance point of view, how absolutely important Western Canada is to our national economy, and in particular, how important the energy sector is to our national economy and natural resources more broadly. So I am very, very mindful of that. I'd also like to point out that throughout this crisis, our government has been there to support energy workers in particular. The Orphan Well program, which provided really significant support to Alberta, BC, and Saskatchewan, was a really important measure to create jobs right away for energy workers across the West, and I'm glad that it was there. I'd also like to point out that these big national programs, like the wage subsidy, like the CERB, like the support that has been available through the regional development agencies, that has gone to people across the country, very much including Western Canada, because the need has been there. So I want to remind Canadians that we have been there for Canadians across the country, very much including Albertans, people from Saskatchewan, British Columbians. I'd also like to point out that in the throne speech, there was a clear acknowledgement of the essential role the energy sector needs to play, and I believe is very enthusiastic about playing, as our country moves towards acting on climate change. And that is a really important shift for our whole country. It's something we can only do with the energy sector being very, very involved. And it's something actually which our whole national economy needs, because this is where the world is going. To quote a fellow Western Canadian, Wayne Gretzky, you got to skate to where the puck is going, not to where the puck is. And we are seeing the entire global economy right now shifting to adapt to climate change. We need to be sure that the entire Canadian economy is shifting too, and that absolutely requires, as an essential part of the work, a close partnership and collaboration with the energy sector and with Alberta. That's something we're enthusiastic about. Okay. Alors,
Answer repeated in French. Our government understands the importance of supporting all of Canada and all Canadians. We understand the importance of Western Canada in our economy and the importance of our resource sector, including the energy sector. We also understand the importance of the collaboration between that sector and the federal government. I can continue, but I don't know if you need me to say it all.
On the phone, operator.
Thank you. Merci. Our next question is from Lena Dib from La Presse Canadienne. Please go ahead. La parole est à vous. Ms. Dib, your line is now open. I do apologize, having no response. We'll proceed with our next question from David Aiken. Please go ahead. La parole est à vous.
Well, thank you very much. Minister Freeland, I just wanted to come back to what you were asked earlier today about committing to a budget, not COVID spending, because, of course, as you know, we spend about $250 billion a year on things not related to COVID, economic development agencies, research by NRCan, you name it. So that's the context in which I'm wondering if you could speak to presenting the government's spending and revenue plan in the current fiscal year. Are you committed to doing that?
The throne speech was clear that in the fall we will be presenting a fiscal update.
Follow up?
And Minister Qualtrough, if I can come back to you on the process question. I know you're not the House Leader and certainly will be following up with them. But I guess many Canadians would say, you've just said that it's urgent that this legislation pass, and we've just come through, 4 weeks of Parliament that was prorogued, where parliamentarians could have been working on this legislation. You could have prorogued yesterday or 2 days ago and had the throne speech. So it's really hard to, maybe you can explain it, why you have this urgency, and clearly you do, but you just wasted a month where people could have been working on this legislation. Can you help me out with that?
Yeah, thanks for the question, David. I'll respectfully remind everyone that we put the elements of these benefits in front of Canadians, in front of opposition members a month ago. And what you'll see in C2 is a very, very similar version, except it's more generous in the amount to what we talked about a month ago. And we have been working with the other parties all along through this process. So again, I stress urgency because we're now rolling up our sleeves to get this past the finish line, but we're not at the starting line here. We are definitely way, way, way closer to the finish line.
All right,
thank you very much.
We'll take one final question in the room.
Kevin Gallagher, CTV National News. Minister Qualtrough, I just want to push back on that because in your introduction, you specifically talked about the potential of school closures and how that affects families. Right now, because of the proroguement of Parliament has not been able to pass these measures. And specifically with the benefit, there have been many parents that have been left with uncertainty as their schools have been closed down. Their households have been quarantined because of COVID scares at those schools. Those parents certainly might have appreciated some certainty of a benefit if they had to leave work to facilitate those closures. So I do have to push back on Parliament has been closed. Parents have been waiting for these measures that you did announce more than a month ago. So is that a bit of a miscue by the government to wait so long till the last minute to bring in this type of legislation?
Well, a couple of things. First of all, this legislation is a combination of 3 different acts. So measures for the caregiver, the benefits, the financial authority piece, and the labor code changes. We wanted to make sure that we knew exactly where we were as a government in terms of the required additional authorities before we move forward with legislation. We signaled a month ago, as I said, very specific details about these benefits. And I've reiterated this as often as I can, that this is what you would expect to see in the legislation. This is exactly what you're seeing in the legislation. There are no surprises, as I said, except for the important note that we're being more generous in the case of the recovery benefit. I firmly believe we're going to bring this through both houses in time, and there will not be a disruption in benefits. But again, I take your point on the urgency.
And I just want, you did mention that some of these, it's obviously flexible like you wanted to say, but some Canadians who have been on CERB will now be receiving less money as we approach a second wave. You did mention that, do I take it from your comments that you don't foresee lockdowns? Because right now, if there was to be a situation where a region or a province needed to lock down because of a dramatic, the types of increases we're seeing in cases right now, some of those people would be receiving less money for the same type of circumstance that they were already being asked to be in back in March and April. So is that a fair thing for Canadians right now?
Well, I can correct, in fact, that nobody will be receiving less money. So the CRB is at a $500 a week limit. We will be ensuring the minimum amount people get on EI is $500 a week as well. So in fact, this is exactly going to be now what people have been receiving on CERB for 26 of the next 52 weeks. Okay. Je veux clarifier que tout le monde.
Answer repeated in French. I just want to highlight that everyone will be receiving the same amount as the CERB, $500 a week, just like the CERB. And if you're receiving EI, you will also receive $500 a week. So the amount won't change. It's $500 a week for all benefits. Thank you. This concludes the press conference.